Welcome back to Casey Cares, Kansas City's nonprofit voice, telling the stories of Kansas City nonprofits and the people behind them. We have the beautiful and wonderful job of telling the missions and the stories of the nonprofits here that serve Kansas City and all the wonderful people behind them, because we have over 8,000 and we try and get as many on here as possible, and we talk about their events, we talk about their mission, we talk about the cause, and we even talk about the problems. Today we've got the American Lung Association of Kansas City, the Greater Kansas City, right?
Greater Kansas and Greater Kansas.
That's even bigger than I thought. That's Sara Prem. She is the Advocacy Manager, right?
That's correct.
Welcome, Sara.
Thank you very much.
Well, tell us what's going on. You guys have a lot of stuff happening, and you said you just got back from Topeka.
Yes, just got back from Topeka. It was Advocacy Day. We had over 200 youth making visits with legislators to talk about resisting tobacco and fighting the tobacco industry's influence.
Yeah, and that's hot these days. I mean, me growing up around a parent who smoked, and I cannot stand. Mm-hmm. And it's so good to see so many youth fighting back. Do you see that happening more and more, or what are the numbers looking like with the youth?
Well, actually, we had done really well, mm-hmm. And the numbers of youth smoking had been coming down. And then about 2015, mm-hmm. when Juul came on the market and the e-cigarettes and the vaping, we started to see that trend reverse. And now we're seeing we're climbing back up in youth smoking. So we have to, we're addressing the e-cigarette problem, and you're hearing a lot about that. The schools are dealing with it, hospitals.
Mm-hmm. Yeah, that's all over the place. And is that where a lot of these tobacco companies have started investing their money, or are these separate? How's that?
Yes, and definitely there's they spent, I think, was $79 million in marketing to in Kansas alone.
Oh, whoa!
Yeah, they have a lot of money.
Wow!
And we know that they're targeting kids. There's the social media influencers campaigns and point of sale stuff and just things that are targeted at youth. And the flavors are a huge problem. There will be adults who say, yes, I love a good mango vape, but it's really about targeting the kids.
Yeah. I mean, and there seems, and you said there's a lot of crackdown, right? It seems like there's a lot of, where there's starting to be a lot of some regulations regarding it?
Right.
Yeah.
So we do have federal 21.
Okay.
So federally, back in December of last year, we have the age of sale is now 21. But we some of the states are also looking at. Kansas has currently got a bill that's looking at 21. Unfortunately, what started out as a good bill has become a not so good bill, and we're actually opposing it.
Oh, wow.
So we have to make sure that when we do pass legislation, it really does protect kids.
Yeah. And now this isn't just about, or maybe it is, but it's not just centered around smoking. You guys focus on lung disease.
Oh, absolutely.
Yeah.
Right. So the Lung Association is like the oldest public health nonprofit organization. We're 115 years old. It started out with tuberculosis. We were working, to attack that epidemic. So our mission now is basically to save lives by improving lung health and preventing lung disease. So that involves certainly smoking, but lung cancer, COPD, asthma, various others. I don't want to go off onto the coronavirus, but
Sure.
that is also a respiratory kind of illness.
Yeah.
So our overall mission has to deal with improving lung health.
And where does that start? Does that start with the air, the environment? How does
Absolutely. We need to have clean air to breathe.
Yeah.
And we tell kids, the only thing that should be going into your lungs is clean, fresh air. That's it. And environmental pollutants. Radon is, I think it was back in the 90s you heard a lot about radon, but radon is like the third cause of lung cancer.
Whoa.
So, it's we might make people aware of that. You can test for radon in your home, get radon mitigation systems.
What is the years on the radon? Weren't there like households that were built and they had like
right, because it's naturally occurring, and we have a lot of rock.
Yeah. Oh, yeah, the foundation.
Yeah.
Okay.
So so Radon is an effort, and so we raise money for our mission is based on three things: research, education, and advocacy. And so we do various fundraisers in our community, Kansas and Greater Kansas City. Just last Sunday was our Fight for Air Climb. It was the 5th annual.
Yes, that was all over the news.
It was a very, very good event. We had over 700 climbers, and you climb up 42 flights. That's 902 stairs.
Yeah.
It's awesome. The best thing is we have the strong support of firefighters, because firefighters obviously have a lot to deal with lung illness.
Yeah.
And so the last thing we do at the end of the climb is have a local firefighters make the climb in full gear, which is like over 60 pounds. So that's really, really moving moment when they do that.
Wow. And how many people competed in that? Or were not competed, but were involved with that? That's pretty big.
Yeah, it was, we had, like I said, over 700 climbers. We have over 100 volunteers to pull that all off. Wow. So yeah, that's a pretty big one for us. And then our next big event is coming up in May 8th. It's the our Lung Force Glam.
Okay.
So Lung Force is kind of a sub-effort within Lung Association, and it's addressing lung cancer primarily in women.
Okay.
And so Glam is our gala event that we do to continue to fundraise for research.
And this is every year, just once
a
year?
Every year, once a year.
How many times have you done the Glam, the Lung Force Glam?
Gosh, I think we're about 4 or 5 years on Glam now. I'm not sure, but yeah.
And that's at Arrowhead.
Yes.
Okay. And then how do you get involved with that? Like, you
can volunteer. You can buy a ticket.
What?
You can buy a table.
Okay.
You can go to lung.org and you'll find information about our local Glam event.
And so, I guess, how many people are involved with the organization here in Kansas City?
Really, we have our volunteers. We probably, throughout the year, between Fight for Air Climb, Lung Force Glam, and then our Expo, which is a education event that we have in November.
Okay.
We probably engage over 300 volunteers with that. We have a local leadership board that is 16 or 18. I'm actually not sure. And then all the participants in our event. So I feel like we have a pretty good presence in the community and get a lot of support from our community.
You said 300 volunteers.
Mm-hmm.
So how would one volunteer if they want to get involved?
Well, you could certainly email us. Just go on our website, lung.org, and contact us and let us know you want to volunteer. And we have a lot of opportunities. We have an advocacy group, our action team, and you can find a link to sign up for that, where you get information about policy, activities, and things that we need. We need you to call your representative or your senator or local. We also deal with local policy, all the Tobacco 21 policies that happened across the greater metro over the last several years. We had a part to play in that. So you can be part of our action network. You can volunteer for one of these events. Certainly, we're always good for donations.
Yeah, and so back to the kind of the root of why you guys are why you're here. I mean, what is a I know lung cancer is a huge issue, and then
right, lung cancer is the leading cancer killer. Okay, men and women. In Kansas, in Missouri, across the nation, lung cancer is the leading cancer killer. So the Lung Association nationally is involved in a lot of research. We're trying to find what you might call the cholesterol of lung cancer. Problem with lung cancer is a lot of times the diagnosis are late, later stage. And so our researchers across the nation are looking for how can we get information about that earlier. The early detection with cancer is the key. So that's a big part of our efforts. But we also do a lot of work with asthma. There's a lot of, in the metro, our asthma rate hasn't really gone down, uncontrolled asthma. And so we do clinics, and we teach we have educators who teach spirometry, which is the breathing tests. to measure capacity. Then we're also we do research in the asthma. We have the Airways Clinics system. I think that's 17 clinics across the country that are doing research specific to asthma, COPD, and other pulmonary conditions and diseases.
Yeah, that's what my mom passed of that. She had COPD, and she smoked her whole life, and it was just. I couldn't stand it. It was just, and I see parents driving around with their kids in the car smoking with the windows up. It's just like, it was just, what are you doing? But there's so many, people don't realize that it's not just smoking. It's the air that we're breathing, the air in your house. I mean, not to fearmonger or anything like that, but there's a lot of stuff that is going up in the air that we are inhaling and we just don't realize it. And it's how do we control that? You were talking about legislation or politicians or policies. What are some of the things that we can do to better our air? Have you seen like a relaxation on that or tightening?
Oh, well, okay. So I will give you an example. In 2010, Kansas passed the Clean Indoor Air Act, and that prohibited smoking in buildings, and that made a huge difference. And we that did overall improve the quality of the air. We also do the State of the Air report, which will be coming out in April. Okay. So that's our national survey of air conditions in all the states across the country. So currently, when you look at the Clean Indoor Air Act, it doesn't have language that includes the e-cigarettes. So that's an effort that we want to add that to the Clean Indoor Air Act, and that should be a focused effort to make sure that we do that, because even though e-cigarettes don't have the traditional smoke of a combustible cigarette, there's still a lot of chemical and particulate matter that's coming out.
Yeah. So. Those the vitamin E that they are putting into the.
Well,
the
that
flavor.
was that idea that they use the vitamin E, the oil, to mix in, and then when the unit heats up and aerosolizes it, and people bring that in. Well, when it gets into your lungs, it returns to being an oil. Yeah. And
creates those little oil goblets.
You're not supposed to have oil in your lungs.
That is not good.
That is not good.
Yeah. And so you're seeing a lot of, I guess there needs to be tightening of that, because nobody predicted that, right, when they made the 2010, or did
right.
they?
Well, I would know, because e-cigarettes first appeared 2006, and I think it started in Japan. We didn't really see it here until like 2015.
Yeah, and that's good. I mean, and at least they're making headway on it,
right?
And it's not too, it's not going to be one of those things like, 20 years ago we should have stopped people from letting kids inhale e-cigarettes in the car. Something. Yeah. So you guys have, I guess as far as the fundraising and the involvement and people wanting to get involved, they can go they can go to your website and check out lung.org.
Correct.
And they can volunteer. They can donate.
You can join our action network. We welcome engagement and would love to have more people helping to improve the condition of our air and the health of our lungs. And
one more thing, people can get involved with that, right? You can write. You had mentioned writing letters.
Absolutely.
And
for example, there's a bill in Congress, the Pallone-Shalala bill, which is a pretty comprehensive Tobacco 21 bill that includes a full flavor ban, so all flavors, all products, and we encouraged our action network to call their congressperson, I think it was in the House, so they call their representative, and encourage them to co-sponsor the bill and to definitely vote yes for it. So there's always something you can do on the legislative side to try to support our work.
And Missouri's getting better at that, right?
They're working on it.
They're working at it. Who's better, Kansas or Missouri when it comes to...
Oddly, it's interesting. Like if you look at expansion, Medicaid expansion, and we're certainly in favor of that, more access to health care. We think that all health care should be accessible, affordable, and appropriate. Obviously, in the news, Kansas is still dealing with trying to get Medicaid expansion. Missouri has it. So but then on the other hand, while Kansas's tobacco tax isn't exactly the highest in the nation. It's still over $1. Missouri is still the lowest at 17 cents. So it just depends on where you look.
Yeah, it's kind of give and take.
Yeah, it could always get better on both sides of the state line.
Yeah, there we go. So you guys can help out. You can go to lung.org, Lung. If you don't know how to spell that, come on now. Lung.org. You can get involved. Be sure to check out the Lung Force Glam. Right, that's what it's called.
Mm-hmm. Yep.
And it's your annual gala. That's May 8th.
Mm-hmm.
And that is going to be at Arrowhead Stadium. You can buy tickets?
Yes, you can buy tickets online. You can sponsor a table. You can sponsor the whole event.
Awesome. Well, Sara, thank you very much for coming on. We appreciate you joining us and telling your story and telling us about what's going on with the American Lung Association in Kansas and Greater Kansas City.
Thank you very much.
All right. You're listening to KC Cares, Kansas City's nonprofit voice.